New here at 6, as more people continue to develop Alzheimer's and dementia, the Alzheimer's Association Illinois chapter and the Illinois Department of Public Health are joining forces to try and stop it. And Delia Jevier is the executive director of the Alzheimer's Association Illinois chapter, joining us now live to discuss the new Illinois Brain Health Project. Delia, thank you so much for being with us. If you would start off by telling me where diagnosis rates are here in Illinois at the moment.
Well, anecdotally, we know that diagnosis is on the rise, and where we don't necessarily have a clear reason for that, we do know that we have worked very hard to raise awareness about the signs and symptoms of the disease and why it's important to seek out an early diagnosis, because we know that there are treatments out there now. And so as a result of that, more and more people are seeking information from their primary care physicians and learning more about the symptoms and actually going into the doctor and seeking out a diagnosis.
Yeah.
So for that reason, we're seeing those rates go up.
So it sounds like cognitive decline, memory impairment. This active effort, as I understand it, is part of a big partnership with a whole groups here. Tell me what the campaign is going to look like and what the exact aim is, how long it'll last.
So this is going to be a very long campaign. The goal is to empower individuals to utilize everyday action to reduce cognitive decline. And essentially, we want them to learn more about what are modifiable risk factors, which are things that you can do every single day to reduce the chance of developing Alzheimer's and dementia. And so through this campaign, with the very simple slogan, "Your brain will thank you," .com, you will go and learn about what those modifiable risk factors are.
Can you give me just a few? Because as I understand it, when brain loss occurs, you cannot get it back, and that's why prevention is so key. What are just a couple of the items that you would pass along for people to think about?
You will learn about is essentially things like if you sleep, you get enough sleep, at least 8 hours a day. If you exercise consistently, 30 minutes of vigorous exercise daily, as well as exercising your brain and your diet, believe it or not, more specifically the MIND diet. You will learn about those things on the website, yourbrainwillthankyou.com.
What are the big challenges that you find that the people are so resistant? I guess many times you don't think about it until you know somebody else, a loved one or family member, notices something is a little off.
Exactly. If you notice, we hear a lot about heart health. Well, essentially, we're trying to pull this information together to say what's good for your heart is also good for your brain. And through this campaign, in partnership with several organizations like AARP Illinois, the Chicago Urban League, and LACE, the Latino Alzheimer's Coalition, LaCare, and many others that are helping us get the word out, as well as making sure that the information that we give out is culturally sensitive and reactive.
It sounds like it's sometimes a challenge to make that an active outreach. You know, if a patient is already seeking care, it's one thing to have that point of contact. But for those who maybe don't visit a doctor very often, how do you make that connection?
That's what this campaign is about, is raising awareness about the importance of your brain and brain health, and doing so before there's a diagnosis, which typically is what happens. Most people become aware of the need for brain health when a loved one is diagnosed or if they are starting to suffer cognitive decline themselves. We're trying to get to people before all of that happened by making them more aware of the simple things that they can do to help their brain and to keep their brain healthy long term.
What made you get into this and try to make a connection to help people out, Delia? So many of us have been touched by this.
Heard so many stories of people that find out about this disease when it's far too late, particularly in underrepresented communities where they're diagnosed at the point where there's nothing that can be done. And the fact is, this disease does not have a cure. Even though we have treatment that are slowing down the progress, there's still no cure. So it's much better. We also know that by the time people are diagnosed, they've probably had signs and symptoms for at least 10 years leading up to it. And so So if we can get in front of it, we can protect our brain for as long as possible, then that reduces the amount of people, hopefully long-term, that get diagnosed, because we also know this is a very expensive disease to take care of, very taxing on families and caregivers.
That's why you're there with the resources. Delia Javier with the Alzheimer's Association. Nice to have you on. Thanks so much.
Thank you.